This is Jacquelyn Nicholson from Pixels and Pills, and we're at the BDI Mobile Healthcare Communications Conference in New York City. And today I'm here with
Jacquelyn Nicholson from the Gerson Lehrman Group.
Good morning.
Thanks.
And what do you do for them?
Well, at Gerson Lehrman Group, I've been with the pharmaceutical industry for 20 years, and I was brought on board to help us to grow our relationships with the most prestigious pharmaceutical and device companies in the world. And so I manage our relationships with 5 of the largest companies in the world and spend a lot of time with their executives, and I travel extensively.
Wow, and so what do you do that relates to healthcare? How does this all work together for you?
Well, primarily what we're doing is we're engaging marketing, brand teams, and business development professionals to help them to grow their business into new areas, into new media, different ways that they might engage their patients and their constituents, including physicians. So what we find ourselves doing is a lot of cutting edge work in new geographies and new areas and helping our clients to understand that. So for me, one of the reasons I came to this conference is a lot of the folks that we work with, especially executives in marketing and business development, are looking for better ways to engage the people they're trying to reach as well. So helping me to get smarter in this area hopefully helps us to serve the clients better.
Exactly. So what do you see for future trends within mobile communications and healthcare? Do you see anything or something that relates to the digital world too? What do you see?
Well, I do. I think the interesting thing is a lot of the presenters this morning have talked about the fact that there's really nothing new. You have to know your audience. You have to understand what your goals are in reaching out through these new channels. So just like there are multiple providers in that area, just like you can get lots of different brands of sneakers or clothing, I don't think we're going to see a lot of consolidation in the industry or in the providers of these things. But what I think we're going to find is, much like my company is sort of granularized, if that's even a word, the way that people do consulting and the way that they get insight, I find that this way of engaging people, and I have an 18-year-old, so I know that she definitely texts more than she talks to people on the phone. So to me, it's a microcosm of what I'm seeing in my own world, and I think the trend is going to continue. I think you're going to absolutely see that there's no such thing as social media or digital media anymore. It's all media. It's just the method by which it's delivered. I don't think you're going to see a lot of different things going away, but I think that what's really going to be the most important is that the regulatory agencies of the world, not just the FDA, but EMA, have to catch up. They have to allow pharmaceutical companies, medical device companies to engage their patients and their physicians in these new ways. And right now, that frankly has been, to me, the bottleneck. Is you have a lot of pharma companies, device companies afraid to engage the patients in these ways because you can't regulate it. There's no borders. You can put on a website, well, you're now leaving the US website and you're going here. So I don't know how you can control it via text and Twitter, but it'll be interesting to see.
So do you think we're going to see a change in the way that medicine is practiced in the healthcare industry?
Oh, absolutely. I think you have to. What's fascinating to me is I think this ends up being better medicine for people. So if you think about the Text for Baby application, and they did this in India, where it was this whole concept of, people in India may not have access to remote healthcare in remote areas, but they have a cell phone, so they can get a text message from their physician saying, your baby's now 3 months old and you'll be seeing these things, you should make sure you take your vitamins, etc. So things like that in remote areas, I think you're going to have the ability to have healthier babies being born. I think in remote parts of the country, I grew up in a small town in Illinois, lucky enough to have a physician locally, but there are parts of the western part of the U.S. and different parts of the world where you don't have ready access to health care. And through telemedicine and remote diagnostics and things where you can at least counsel somebody to be able to do something, I think you're going to see some great ways that health will be improved in the world. And then I think, frankly, we have to move on to some of the more basic things like making sure people have clean and fresh water. I don't know how we impact that from that standpoint, but I think at least being able to remotely provide counsel, diagnoses, and options for people and direct them where they can go to get face-to-face help when they need it, or medicines or equipment or what have you. Hopefully that'll sort of shrink the world that we're in from that perspective. So I think it has to change.
Well, thank you so much. That's a lot of great insights. And this has been Jacquelyn Nicholson from Pixels and Pills.